This is Carly. She is a 21-year-old healthy student that attends Michigan State University. She's constantly striving to eat a balanced diet, she works out, and fits in some relaxation time whenever she can. She strives for a healthy style because she knows that in the back of her head she can get a migraine at any moment, and it terrifies her. Why does it terrify her?
I had my first migraine when I was 20 years old, and I was actually at work. I was working as a camp counselor, and it was a completely normal day. It was the end of summer, completely not stressful or anything, and all of a sudden, I got this aura, and I was like looking across the field at my camper, and I couldn't see her face. And I would like move my eyes around, and wherever I looked, that blind spot, that aura would kind of follow my eyes, and I completely freaked out. I lost all peripheral vision, and then my head started pounding really bad. And I looked at my watch and I was like, oh, this sucks. My shift is another 3 hours. And then after that, half of my body went numb. And once that happened, they called 911 because I had never had a migraine before. So I didn't know what those symptoms were. I didn't know what was happening, and I was in so much pain, and I couldn't feel the whole left side of my body. It was that tingling sensation. And I told the paramedics all my symptoms, and they couldn't really figure it out. And then I went to the doctor, and they were like, oh, you had an aura, you had numbness and a headache, you had a migraine. And it was just a really scary experience because the pain is just unbearable.
A migraine is an intense throbbing or pulsing sensation in one area of the head. Carly had it in the back of her head, and this is a pretty common place for people to get it. It's the most frequent neurological disorder in adult population worldwide, affecting up to 12% of the population and 25% of women. Symptoms include nausea, vomiting, extreme sensitivity to light and sound, blurred vision, lightheadedness, and fainting. What sets aside migraines from other health problems is its ever so obvious warning symptom. The warning symptom is known as the prodrome. It lasts about 20 to 60 minutes. It causes visual pneumonia, such as seeing various shapes, bright spots, or flashes of light, vision loss. You can get pins and needle sensations in your arm or leg, and you can also have speech or language problems. More prodrome symptoms include constipation, depression, food cravings, hyperactivity, irritability, neck stiffness, and uncontrollable yawning. The migraine attack lasts about 72 hours. The pain that occurs after the first 24 hours is known as the migraine hangover or the postdrome, which has feelings of being drained and mildly euphoric. When should you see a doctor? You should definitely see a doctor if you have an abrupt, severe headache, kind of like Carly did. If you have a headache with a fever, numbness, stiff neck, confusion, seizures, double vision, weakness, or trouble speaking, or pain worse after coughing or sudden movement, you should definitely seek attention from a doctor. Migraines occur when there are changes in the brain stem. There are interactions with nerves that can go wrong. There can be imbalances in brain chemicals, especially serotonin, which helps regulate pain in the nervous system. And serotonin levels tend to drop during migraine attacks, which make the pain more severe. They can cause a release of neuropeptides that travel to the brain's outer covering and result in even more headache pain.
When I found out that it ran on my dad's side of the family, I got really nervous because that meant that it probably could be a reoccurring thing. And so I went online and I just researched, and I found that food triggers are a main thing for migraines, and also stress, light sensitivity, that type of thing. Blood glucose is one. Light sensitivity and sound sensitivity are both things that I had also with my migraine, but that wasn't until the actual attack when I was in the doctor's office and my head was pounding, I turned off all the lights and it was super quiet, and I just, after the doctor's office, after they gave me a bunch of medication, I laid in my room for just 10 hours straight with the lights off, no sound, no nothing. But ever since then, I walk around with the medication they give me, because if I ever feel that kind of pain and that kind of fear again, I want it to stop immediately.
So migraines are genetic. 90% of people with migraines have a family history, and they can occur at any age, but they are most common during adolescence up to 40 years old, and in women they are 3 times more likely to occur. Hormonal changes can often trigger migraines. The fluctuation of estrogen before or during a period can trigger them, or if a woman is on hormone replacement therapy, this can also trigger it as well. So what foods trigger migraines? Foods like aged cheeses, salty processed foods, skipping meals, or fasting can trigger migraines. Additives like aspartame and monosodium glutamate can trigger migraines, and also alcohol, and most specifically red wine, will trigger migraines the most. Other things that can trigger migraines include stress, or even coming right off of stress. Sensory stimuli like bright lights, loud sounds, and unusual smells can trigger migraines. Too much or too little sleep, intense physical exertion, and changes in environment can trigger migraines. And even medications. There was a study done in 2003 with Science Direct to study the triggers of migraines, and they had participants, including children and adolescents, and they had a table of food, as you see here, like cheese, chocolate, citrus foods, that they thought would trigger migraines, and they made another table with foods that they could replace with those migraine triggers. So the participants ate the safe alternative foods instead, and the result of this study, with 83 participants in this elimination diet double-blind trial, 93% of participants were free of migraines because of this diet change. And since this was such a successful study, it can be concluded that this list of foods is highly correlated to the trigger of migraines. Another one of the main conclusions from this study is to avoid tyramine. Tyramine can be found in cheeses, leftover food, wine, beer, beans, and sauerkraut. And another problem with tyramine is that people may be deficient in monoamine oxidase, which can cause tyramine to be absorbed more quickly. And tyramine is a very large migraine trigger. Dr. Fred also states that blood sugar can be a migraine trigger as well. He recommends to eat bread and sugar to increase blood glucose. Since the brain is about 2% of your body weight, and your brain takes 25% of the glucose you consume, then the result is if you have low blood sugar and your brain can't function because of it, it can result in a migraine. It's key to remember, though, that migraines are caused in many people by compounding factors. If you experience a strong smell like perfume, flickering or flashing lights, less sleep, and you eat a cold-cut sub with nitrates all in one day, yes, you may get a migraine. But if you ate that sub on a day when you didn't experience those triggers, you might be just fine. There is also an array of alternative medicine that can help people with migraines, including acupuncture, biofeedback, which is a relaxation technique using special equipment to teach physical responses related to stress like muscle tension, which can be found in people with migraines, massage therapy, and herbs, vitamins, and minerals. Worrying about getting a migraine all the time can be scary for Carly. However, since her research, she has been able to adapt her lifestyle in order to reduce the risk of triggering another migraine, and she is happy to say,
And I haven't had one since.
Yes!